I'm Pam. I'm a survivor of childhood sexual abuse, and I'm a person living with post-traumatic stress disorder. Today, I'm going to be starting a two-part video on eye movement desensitization and reprocessing therapy, better known as EMDR. And this approach is used to treat the symptoms of post-traumatic stress disorder. And I'm doing this video series because I would say that EMDR was the most effective, by far, approach that I used for my own treatment. And I think that it is, even though fairly widely known in, support groups and whatnot for people who are living with PTSD, I think that it's really still not fully known as widely as it should be. And in this two-part series, I'm going to first talk a little bit about the science and theory as to how EMDR works, and then in the second part, I'm going to talk about my own experience. So, how does EMDR work? EMDR actually is, it works by stimulating both sides of the body, and in doing that, it activates parts of the brain that don't normally communicate and transfer information. And so through this bilateral stimulation, and initially when EMDR was developed, it was initially visual, but in addition to light bars, so bar of light that goes back and forth, there are also hand paddles that can be used, so you have one buzzing in each hand, or you can use headphones. And it can be done actually even on an iPad with the moving light. And in the more primitive early days of this therapy, actually a therapist would just wave their hand back and forth. And the treatment itself is done in sprints. So for the treatment, you would actually focus on a traumatic memory. And you, have somehow the activation work in there to transfer the memories. And so you focus on it for about a minute or two, and then you stop. So it's not a long duration of actually doing the EMDR process. That piece of it is actually fairly short. And then there is, of course, a lot of discussion with the therapist to help direct the person in what they will focus on to process. And that brings us to a little bit about traumatic memories. So one of the things that is recognized is that part of why, or I guess all of the reason why, PTSD develops is how the brain works. And what happens is that when a person is traumatized, the memory is not stored in the same way as other, ordinary memories. It's stored in a more primitive part of the brain. And that place in the brain where it's stored creates the problems of PTSD. It creates things like flashbacks. It is very common for that part of the brain to store things in fragments, which is why people often will have a flashback of simply a body sensation or simply an emotion. Also, that part of the brain doesn't really provide the perspective of time all that well. And that is why people who have flashbacks, including me, will tell you that the flashback feels like it's happening now, or like it just happened. And that part of it too is really, tough. So a lot of, the symptoms that are associated with PTSD are coming from how that memory is stored. And so the EMDR is designed to actually take, the bad place where the memory is stored. It's not really a bad place. It's just, a place where it's stored. And it transfers it over to the place where normal memories are stored. And that helps to either eliminate or at least reduce the symptoms. Now, does that always happen? No, it is not an effective treatment for everybody. But it is a very effective treatment for many, many people. In fact, so much so that some people, after doing EMDR, no longer meet the criteria for PTSD, which pretty much is about as close as we get to a cure these days. So I think I've talked about some of the, mechanics of how EMDR works. How many sessions is really determined by the person's trauma and their individual needs. It is a form of therapy that's very similar to another type of therapy called exposure therapy. And in exposure therapy, a therapist works with a person to actually go through the worst memories they have. And in a lot of ways, EMDR is not that different. But in exposure therapy, you don't have the tool of the bilateral stimulation. Whether or not they are, it's very hard to say scientifically, what the EMDR is adding on top of that. But the research, and that actually brings me to the whole discussion of research, the research on EMDR is very encouraging. It is not an alternative method. When someone first described it to me, I felt like that sounds super shady, but it isn't. It is, it is legit. There has been research showing that it has an effect. It definitely does for many people reduce symptoms or eliminate them. And also it is long lasting, which is exciting. Actually, there have been brain scans done of people while they're doing EMDR, and it has shown that it actually appears to work in the way that is theorized, that it actually does, light up those parts of the brain that show that primitive brain where the traumatic memories are stored, and that, normal storage area. And, it is showing that, yeah, looks like that is the way it works. So I think that there are a couple of things that I want to close with. One is saying that it doesn't work for everybody. And that doesn't mean that you failed. It means the treatment failed. And unfortunately for some people, it doesn't work. Some people are re-traumatized. I was re-traumatized by going through the process. But you have to, if you're going to go in, you have to go in knowing that if things get worse, you're going to have to stick with it for a while. And that's why you need a therapist who knows what they're doing to help you over that kind of hump. Because sometimes things get worse before they get better. Of course, another risk is that it's not going to work. Even for people for whom it does work, it can be extraordinarily rough. And I think that if you are, if you have a loved one who's using this therapy, understand that they are confronting the worst stuff that has happened to them. And for a person, who is a survivor of childhood sexual abuse, you don't even want to think about it. Confronting, those memories and, all of that emotion and pain and, having to feel some of those body sensations is really tough. But there is an incredible reward there as well. And so it takes some courage to do it. But for many, many people, it is really just quite an amazing treatment. So I hope this was helpful. In my next video, I'm going to talk about my own experience with EMDR. Thanks for watching. Bye-bye.